Hello, and thank you for listening to the COMLEX Instant Podcast. Let's review another case today. For each of the following physical findings or group of physical findings which I state, select the appropriate cardiovascular disorder which is most likely associated with it. Argyll-Robertson pupil. That's Argyll-Robertson pupil. What are you thinking? Are you thinking aortic regurg, coarctation, myocarditis, massive tricuspid regurg, or a thoracic aortic aneurysm? The answer here is going to be, obviously, a thoracic aortic aneurysm. Remember, the Argyll-Robertson pupil is a pupil that constricts with accommodation, but not in response to light, and it's characteristic of central nervous system syphilis, and is associated with a vascular manifestation of the disease treponema pallidum, which invades the vasovasorum, causing obliterative endarteritis and necrosis. The resulting aortitis gradually weakens the aortic wall and predisposing it to the aneurysm formation, and once the aneurysm is formed, the prognosis is usually grave. What about exophthalmos? Is it associated with? The answer here is massive tricuspid regurgitation. Okay, massive tricuspid regurgitation produces an elevated venous pressure, alright, and usually manifested by severely engorged liver. So if the venous pressure is sufficiently elevated, sometimes patients can have exophthalmos. Tricuspid regurgitation of rheumatic origin is almost never an isolated lesion, and the major symptom of patients who have rheumatic fever usually are attributable to concurrent left heart disease, and bacterial endocarditis from intravenous drug use is becoming increasingly important cause of isolated tricuspid regurg. Now, what about Quincy's pulse? That's Quincy's pulse. What cardiovascular disorder is it associated with? The answer here is going to be aortic regurgitation. Yeah. All right. Quincy's pulse consists of an alternate flushing and paling of the skin and nail beds and associated with aortic regurg. Other characteristics include peripheral pulse in the aortic regurg, which has a water hammer pulse-like appearance called Corrigan's pulse, caused by a rapid systolic upstroke, and pulsus bispherians, which describes a double systolic hump in the pulse contour. The finding of a wide pulse pressure provides an additional diagnostic clue to aortic regurgitation. Let's review another case here. Conjunctivitis, urethral discharge, and arthralgia. What are you thinking? Well, it's going to be myocarditis, okay? Conjunctivitis, urethral discharge, and arthralgias. That's myocarditis. Myocarditis, aortitis, and pericarditis have all been described in association with Reiter's syndrome, and the original description included conjunctivitis, urethritis, and arthralgias. Although its cause is still unknown, Reiter's is associated with HLA-B27, alright, and so keep that association of Reiter's and myocarditis with aortitis and pericarditis in mind. Finally, let's review another case. Short stature, webbed neck, low set ears, and epicanthal folds. What are you thinking? Well, the answer here is going to be coarctation. All these are signs of Turner's syndrome, and people with Turner's are commonly linked to aortic coarctation and are genetically exo. However, females and males have been described with normal sex chromosome constitutions like XX and XY, but with the phenotypic abnormalities of Turner's syndrome. Additional cardiac lesions associated with Turner's syndrome include septal defects, valvular stenosis, and anomalies of the great vessels. Okay, so that was a review of some of the associations with cardiovascular disorders you want to keep in mind for the boards. Please visit comlexflashcards.com as always for additional lectures and resources, and good luck in your preparation, and thank you for listening.